well in terms of what we see. And in this 25th anniversary of WPS, are we getting closer to our overall goals for improved security and peace for women in particular? So maybe, Kemi, if I can start with you, I'll turn it over to you for any thoughts.
Okay. Thank you very much. And thanks for the detailed overview. For us in Nigeria, sexual gender-based violence continues to be a priority issue of concern within the context of public safety and security. And you've highlighted the different reasons, the different issues that make it a priority concern for the country. When we look at the policy and legislative framework, we have made some progress. So, for example, as at today, the Violence Against Persons Prohibition Act has been adopted across the 36 states, across all the states except Kano State. We're waiting for the adoption of the VAP in Kano. It's only Kano State that has not adopted the VAP. The Child Rights Act has been adopted across the 36 states, including the FCT. The Administration of Criminal Justice Act has been adopted across the 36 states, including the FCT. So the question you ask is, if we're having a scenario where the legal and the policy environment, and to state on the policy environment, I think we have the third iteration of the Women, Peace and Security National Action Plan within the country. As at this morning, my colleagues shared with me the draft of the state's action plan for Niger State. So you find states are trying to close that gap when it comes to policy, when it comes to legal framework. For the police, the police has completed the review of the gender policy. The gender policy the second iteration of the gender policy has been adopted by the Nigerian police force, worked with a team that we recently concluded work on the review of the police regulations. And one of the things we did was that we embedded the police gender policy in the regulation so that you're giving it multiple platforms to ensure that it's implemented. Of course, you know, we have the Police Act 2020. So what's the difference? Why are we not seeing changes on the ground? One of the things we highlighted, and you highlighted it, was that one of the gatekeepers, first responders, are the traditional and religious leaders. The traditional and religious leaders continue to be a strategic, critical gatekeeper, even though they are not formal criminal justice response actors. But because of the way the society is shaped, they're either facilitators or enablers, so they're responders. Over the past couple of years, P1 has worked with traditional and religious leaders to try and change their thinking and the cultural norms and the orientation around response to sexual gender-based violence. Presently, we have an ongoing grant, coincidentally also from Ford Foundation, and we're working in Kano, we're in Ebonyi, we're also in, can't remember the other states. We are at Niger, working with them, and Kaduna, also looking at these issues. And what we find is that it's of maybe culture and religion. Interpretation and putting text into context. We've had opportunity to train them, develop manuals that are targeted for the religious and traditional rulers. Are we seeing changes? Yes, we are. We're seeing changes in the crafting of their messages. We're seeing changes in the kind of messages they deliver from the pulpit, either in the church or in the mosque. We're seeing more collaborations between the two religions and having an agreed position on this issue. So I'll give an example. For the Christians, we're familiar with having pre-marriage counseling classes. Pre-marriage counseling classes was not something that was that the Islamic clerics told us they don't do it. It's not, it wasn't part of the system. But we've seen some of the Islamic clerics that we've engaged with adopting the thinking around premarital counseling classes. When it was close to Ramadan, when we had the big Salah, we call it the big Salah. We found the Islamic clerics. We identified scenarios that that facilitated sexual gender-based violence. So, for example, you're giving food to your neighbor. Do you send your underage child unaccompanied to take food to your neighbor? No. So you had messages clearly crafted, you know, highlighting the different incidents that could happen that could, you know, put children in harm's way, and the community coming together also to push these messages. In the southeastern part of the country, in August, we have something that is called the New Yam Festival, and people come home for the New Yam Festival. We've had scenarios where the women that in certain communities have come together to say, you know what we need to do is to ensure that young girls are not seen as tokens of part of the festival. And there are conversations, there are discussions that are going on around this. I chair an organization in, it's an NGO in Edo State, Braveheart Initiative. As at the time we had this research, the number of convictions that we had on paid for VAT was very low. But Braveheart has recorded good success on convictions for perpetrators of sexual gender-based violence within its community, Akoko Edo in Edo State, using the Violence Against Persons Prohibition Law. So there are, like I said, we're making progress. It might not be as fast as we want it to be. It's an issue of cultural, behavioral change, right? Behavioral change, we know, is something that has to be, the messaging has to be consistent, the accountability element has to be consistent. For the police, I'll be looking at rounding up quickly. For the police also, one of the things we found, you know, we say that police response to sexual gender-based violence at times is not encouraging, that they might tell them, go back home, it's a family matter, When we had a conversation with, we had a meeting some months back with the AIG, who is the gender advisor to the Inspector General of Police, AIG Aisha Baju. She mentioned to us that she's had cases being reported to her by the wives of serving police officers being perpetrators of sexual gender-based violence in their own private space. Okay, so when you have somebody that is a perpetrator and you're asking the person to respond, the person cannot respond effectively because the person is doing the same thing in his own or in his or her own private space. So what we said to her was, okay, with this project we're having, we're engaging with traditional and religious leaders. Do you have religious enclaves within the police itself? And she said, yes, we have chaplains and we have imams. So we co-opted the police chaplains and the police imams into the project, also with the same mindset that they most likely at times might be the first responder. Because if anything happens in the barracks, you call your chaplain, you call your imam. So what messaging? how are they crafting their messages? And we extended that also to the Nigerian Security and Civil Defense Corps. The other element of it is raising the awareness with the Police Service Commission that the Police Service Commission has a responsibility for appointment, promotion, and discipline of all police officers except the Inspector General of Police. The Code of Ethics and the Code of Conduct for the police does not accommodate this. So how is the accountability trigger being used within the police to ensure that when the spouse reports, what is the action that is taken? Same as we're saying with the members of the public, it cannot afford to be swept under the carpet. It's the same thing that it cannot afford to be swept under the carpet, to be seen as a family matter and asked, we would settle it. If there has to be formal disciplinary process initiated against that officer, saying that has to happen. Strengthening the voice of the survivors also looks at referral mechanism. Last week, with a debrief with my team, we're looking at Kano State, for example, and the conversation around having HISBA embedded in our trainings, also taking place in Kano State. And again, we found that in Kano, people feel more comfortable going to HISBA. So when there are referrals, they either go, when there are issues of sexual gender-based violence, the women could say, if this continues, I'm going to report you to HISBA, not to the police, right? HISBA is the Sharia police. So that also gives the face of the religious affiliation, right? Then you also find scenarios where they report to the traditional rulers. Part of the country, you hardly find a difference between the traditional and the religious leaders. They kind of cohabit, and you find they report to their traditional or their religious leader, who most likely would send the report to HISBA and not to the NPF. So what we've tried to do in Kano is what we're doing in Kano now is to work with all the agencies in Kano to develop a referral pathway that is clear and it's distinct, and all the actors know what it is, so that we ensure that at the end of the day, the survivor's interest is not jeopardized either by virtue of bureaucracy or by virtue of lack of interest. And I'll stop there. Thank you.
Wonderful. Thank you so much, Kemi. And really some very, very encouraging things that have been happening over the last few years. And that's really excellent. I'm just struck by the issue of bringing in the police who are chaplains and imams early in the process, and kind of getting the buy-in to address some of the situations that you mentioned where you have, perpetrators perhaps within law enforcement. So excellent. Thank you. I think maybe let's, if Bosch, you could jump in here. We're going to pick up on some of the law enforcement themes with Rita later, but Bashratu, if you could share with us a bit about your reflections on what you've heard, and then please share, kind of the Ghanaian context and where you see things going there.
Thank you very much. I hope you can hear me, Kira.
Perfect.
Yes, thank you very much. And let me start off by saying that everything in the reports represents the Ghanaian context, except maybe in terms of explanation and in terms of responses, that some of the things might be different. But basically, in terms of the findings of the report and the gaps that we have and deficiencies and other things, not so different from the Ghanaian context. But hitherto, I would want to touch base on a few of the things that have been raised so far. We have a deficit in terms of issues around migration too. The danger with migration, which has become an issue of interest, and how the security agencies come in, is how it is playing out now in our context. So we have human trafficking and the type of violence against women and children that it is bringing in for us. So in Ghana now, we have several cases and incidences of a lot of young ladies and children are brought in from especially Nigeria and are told that they are going to do some form of work. They end up being asked to do sex work without their consent. Now, the approach in terms of rescuing them and the work of the security agencies become a bit difficult because this is a whole supply chain, and it might not even have a face in terms of who is directly responsible. So when you even are directed to a house where these vulnerable groups are, you would go there and you might not be able to see who is directly responsible, but only meet a room or a house full of young people brought in, trafficked, knows no one, doesn't speak any language, any Ghanaian language, English language not too good. The security agencies have to rescue them. And it's a whole mess. Most of the time, even after they've managed to rescue some of them, the challenge is about whether our systems accommodate them in terms of coverage by the law. So it becomes a challenge. The other challenge, which I felt was not highlighted much in the report, the referral mechanism has to do with shelter, which is the biggest challenge that we currently have in Ghana, whether it's around those who are trafficked, IPV, intimate partner violence, whether it's workplace violence, whatever type of violence that we are talking about, issues around shelter remains the biggest challenge that we have. Because after removing survivors, and the survivors do express an interest that I am not going back to the house or whatever it is, it becomes difficult because you do not have a place to put them. So sometimes the agencies have to rely on civil society or non-governmental organizations who provide private shelters. And in Ghana, the known one is one. It's just one, Art Foundation. In terms of the national level, we only have like 2. And we have 16 regions. Out of the 16 ranges, just 2. So this is some sort of frustration also for the security agencies. After all is said and done, you do not have a place for the person. What do? Do you ask the person to go back to where they are being abused, or you take the person to your personal space that you use, which is also equally not safe? Then, in terms of female representation, yes, we have a similar issue. And sometimes I also raise a concern about the fact that people sometimes feel like when there are more women, incidences and then reporting will go up. Could be true, but that depends on whether the women we are talking about appreciate and really understand issues of violence against women. Because we've had instances where women officers have been the one advising survivors or victims to go back to their family and behave right, as they will put it. And so, yes, it's important to have females because it's important for people to identify with someone who looks like them or might have had a similar experience as them as well. Then institutional policies and procedures, extremely important, because without policy direction, we'll just be working in a vacuum with no any clear focus on what we are actually doing and the type of responses that we give. So that is also a very big challenge that we have here. We have national laws, but the laws are scattered in different books. So you have to find a way of looking for those laws around. So we have the criminal code, we have the Criminal Offences Amendment Act, we have the Domestic Violence Act, we have the Cyberbullying Act, and all of that. So it's scattered across. If you have an officer who has not been through any formal training about one, understanding gender-based violence, violence against women and girls, knowing and being able to see what the red flags are, what type of response mechanism, case handling and others, and does not also know the law, then you have a problem. We have had security people who will ask you, so what am I charging the person for? Because they do not understand and they do not even know what exists for them in terms of procedure. The other challenge that our security agencies and we also face is that in Ghana, if someone is abused and it's like, let's say a physical abuse, battery assault, or a woman has been defiled, a girl has been defiled, a woman has been raped, and they turn to the police. Once the police give them the sheet or the report to have a medical checkup, they are required to make certain payments to the hospital. Mostly the doctors are the ones charging that fee. And you can imagine someone who does not have resources to have 3 square meals a day being asked to pay 300 cedis, which should be, let's say $20, $25. That is wild because the person will not be able to pay. So it brings a big gap. While the security agencies are interested in supporting the person, the procedure has been flawed because you are unable to go to the hospital to get the reports that is needed to support you. Then capacity building and preventing violence against women. Important, yes. But the vacuum and the challenge we have there is the fact that government agencies are unable to help the police. So mostly it is the civil society groups that must support and are able to put resources together to do this. And Ghana has created the Domestic Violence and Victim Support Unit just for these purposes. Does it work? Yes, because you would find an officer in charge in every police station that you go to. Do they have the capacity? Questionable. Do they have the resources? Questionable. So if you put in these systems, policies, but the procedures are not clear and they are not adequately resourced, what happens? So we also have a very big challenge there. Increased reporting, a big challenge. So we keep asking ourselves, if every year, whatever report comes out from the Ghana Police Service is what represents the totality of the amount of people who have been abused in their relationship, women, girls, and other groups. Because a lot of people we are still aware are not reporting. And it can be linked to the issues that you raised earlier, which is cultural and religious value system. People prefer to use the community system too. So religiously, it is wrong for me to report my husband. I've been involved in a case where a woman was bold enough to drag the husband to court. By the time the case was over, the man was sentenced to 5 years. When it was time for the man to be released from jail, the man sent word through his family to the woman that she should find a new place to live because he's coming back. Now, after the trial and everything, the support systems, services were also not there. So what next? What could happen? What are the alternatives? What could we do? These questions were not asked until after 5 years when the gentleman was coming out of jail. So this woman has to now start looking for ways to not just escape, but to set herself up to be able to survive because the system does also not provide any sort of financial support. We are supposed to, as a country, have the Domestic Violence Fund. We do not have it yet. Government has not put any monies into it. So it's still non-governmental and civil society organizations who are amassing up support to do that. So I think the report reflects generally a lot of the things that are happening in Ghana too. And if we dig deeper, I am sure even the context might be the same because religion cuts across. It's Christianity, it's Islam. And that is what is ruling all of us. And the texts are the same. So I think that, yes, it's important and we must find ways of resourcing the police force, other security agencies because of the other forms that are coming up. like I mentioned, human trafficking, sex trafficking. So immigration is also involved, but they don't understand. I have never even heard of a formal training being done for immigration officers at our borders to be able to screen and know that this is trafficking, this is this is that. So whilst we are discussing the police, we should also look at other security agencies and their mandate in terms of helping us to address some of these issues as well. Thank you.
Thank you so much, Bash. Really very important topics that you raise, and just the last one that you reiterated about the need for other security agencies beyond the police to really understand not only the laws, but to recognize the issues that are attached to migration, other things that they are engaged with that affect women and women's rights and this issue of violence. Wonderful. Well, let me turn it over to Rita now. Rita, again, from the Nigerian perspective, your thoughts about what the research has revealed, and perhaps even addressing some of the points that were raised by Kemi and Bash. Over to you. Rita, are you ready to come off microphone? Yeah. Hi, can you hear us?
Hello, can you hear me?
Yes, we can. I just was turning it over to you for your reflections.
Yeah, it's raining heavily, yeah, heavily. But I'll do the best I can.
Okay. If you want to turn
everyone.
off your camera, if you want to go to turn off
The
your
rain is
camera.
so heavy, yeah.
Yeah, we can see.
Yeah, can you hear me? I'll be as brief as possible. Good afternoon, everyone.
Good afternoon.
Yeah, basically, I'm in charge of investigation of gender-based violence cases, and upon assumption of my office, I've been able to encounter a whole lot of cases. So, as it is, it may interest you to know just what my auntie Kemi has said. The gender officers across all 36 states of the Federation, including the FCT command. So this gives us a wedge over
Rita,
investigating gender-based violence cases. So
Rita, we're having a hard time. Hi, Rita. We're having a little bit of difficulty hearing you.
Sorry?
We're having a little bit of difficulty hearing.
It's raining heavily. It's raining heavily, heavily. Well, maybe
Yeah,
we
okay.
can give a little time.
Yeah, so the rain is interfering. All right.
So maybe
yeah,
I
do you
could
want to
say
yeah,
yes, just
jump
a
in.
bit on the gender
Exactly.
on the gender unit. Also, while she was making the presentation, it occurred to me that the project that was implemented that started off the gender unit was also supported by Ford, right? So it was a pilot project that was implemented when I was at Clean Foundation then. And over time, the gender unit has grown from just being in 6 states, one state in each geopolitical zone, to across the 36 states of the country, including the FCT, and Dr. Rita heads the team. And recently, some couple of months back, the IG gave directive for the gender desk to be replicated to the divisional level. So it's moved not only from the state onto the now at the divisional level. She's back, so I'll hand over to her.
Are you able to come back on, Rita? We see you, and we thought maybe you're connected again. Can you hear us? Rita.
Maybe one would also say that maybe closely, you have the gender desk, so gender units across the 36 states and across the divisions. You also have the sexual assault referral centers that have also been replicated across different states. So you see the attempt by the state and by civil society to ensure that we have like institutionalized approach of responding to sexual gender-based violence. The issue of capacity building, I can confidently say that for the gender unit in the police, for those that have been at the state and at the FCT, I believe that they've been saturated with training. The word is saturated because all donors, when they come in, they support. However, one of the gaps we identified recently, because Dr. Oki and I were at a workshop together, and she raised it, is the need to replicate and train the officers at the divisional level, because it's just been scaled down to the divisional level, so that the officers at the divisional level are as skilled as the officers at the state level. Do not forget that policing happens at the local level, so that when the matters are reported at the police station level, which is the divisional level, there are skilled officers to take up this matter. It's at the divisional level, it's taken up before it even moves to the sexual assault referral centers. Engagement with colleagues that work on response also to gender-based violence. From BHI, my colleague at BHI would tell me, and I also see it, is that we put a lot of accountability on the table of the police, but the accountability on the table of the medical facility to also be at par with the police and the law enforcement in responding to some of these issues is a bit, it's not commensurate, right? So you can have scenarios where when the person comes in, we know that this is a vulnerable person and you are asking the person to pay. Is it the police that will pay the bill? Because the police doesn't have the resources to pay the bill. What can be put in place, right? When the samples are taken and investigation goes on and the doctors or the medical personnel have to appear in court, there's the reluctance to appear in court, which further complicates or delays the judicial process. Another level of it is when we talk about respect for the survivor and the decision of the survivor. What does the survivor want? What is justice for the survivor? We run a legal aid pro services. P1 runs legal aid services, and we intentionally target young women, vulnerable population, victims or survivors of sexual gender-based violence. And at times you find you get the police to respond effectively. The survivor gets her day in court. And some of the lawyers will tell me when we have regular debriefs that you're getting phone calls from the survivor saying, I've not eaten today. My kids don't have anywhere to stay. So which resonates with what my sister from Ghana, Bashiratu, said. What happens? So we need to have the conversation around justice. What is justice for the victim? Is it justice through the legal system? But what happens to the victim if we say it's survivor-centered response? How does that victim pick up his or her life? I keep saying his or her life because experience in Kano also has shown us that young boys are defiled, young boys are sodomized, right? And at the end of the day, this culture of silence, as it relates to boys, I think is worse than the culture of silence as it relates to the girl child. Because for the girls, I mean, we've started talking about it, but for the boys and the young men, there's nowhere to go to, right? The shelters, I think we have more than 2 shelters in Nigeria, right? And shelters are run by, yes, civil society organization. I don't think any government, I think Lagos State has a shelter, right? But I don't know how functional the shelter is as per responding to sexual gender-based violence, because I think their shelter basically kind of responds to another category of vulnerable population. So the management of shelters, the accessibility of shelters, it's not cheap to run shelters. So for colleagues that run shelters, where is the support coming from? And they cannot stay in the shelters forever. They have to transition from the shelter elsewhere. I would say again that Lagos State, I think, of all the states in the country, has the best model for responding to sexual gender-based violence with the Domestic Violence Response Agency. It used to be a team, but it's now an agency that pulls together the resources of the state, from education to justice, to health, to try and ensure that there's effective response to these issues. And I'll stop there. Thank you.
Thanks very much, Kemi. And I want to go to our audience for any questions and comments they have, since we're getting to quarter after the hour. But wanted to make sure that we, do we have, is Rita still on? If there, I guess, no. Okay. Whenever she gets back on, we definitely would want to hear from her again. Yeah, thank you very much, Kemi. And a lot of just really, interesting points. Certainly the victimization of boys and, not just the girls and the women is super important. And this issue of, being able to have a holistic response, the medical, the psychosocial, the legal, and all of that is, I think in a lot of ways, if you don't have a whole approach, then even the elements and the different pieces are not as effective as they could be. One thing I wanted to maybe touch on for you and Bosch to respond to is mention, the training, the capacity building, and the issue of the government and authorities not really having those resources, even to make sure that things trickle down to the divisional levels. How is the collaboration between CSOs, between civil society and the authorities and, institutions? Are there ways in which that could be tweaked and improved, short of just putting more of the responsibility onto civil society? Has that changed in the last few years? You talked about the divisional levels being trained in a way that they hadn't before. Was that being done by law enforcement themselves, by the institutions, or was civil society involved with that?
It's civil society. It's civil society. However, the approach that is now being adopted, and I say this by virtue of the fact that I'm working with the UNDP police reform team, is that moving away from the system whereby civil society organizations come in and we say we want to train 50 officers, and they give us 50 officers and we train. Now we're taking an approach of working with institutions. We work with DTD, that's the Department of Training and Development, and training and development have an input into the agenda, into the structure. And there's another group of colleagues within the same reform team that is working on the curriculum development. And as we're working on the curriculum development, there's another group that is working with the training institutions and look and engaging the instructors. So you see that it's compartmentalized, right? Such that the colleagues working with the training, with the trainers, is looking at training approach, what works with, what should work, what kind of approach do you use in delivering this kind of content. That was never there. For what I know we used to do was at best stop at the level of the curriculum development, right? And ensure that you make input into the curriculum, but you're not looking at the delivery of the content of the curriculum. But this, again, I say, is still being led by bilateral civil society. So we're hoping that the ownership, as the police own the process, and they get to start delivering the training on their own, right? Because again, like I said, the policies are in place. The content is in place. The legal framework has changed. The policy environment has changed. It's the will and to do the right thing, right? And I'll stop by saying that the will to do the right thing is also, it's two-way traffic, right? On the part of the police and on the part of the government to indicate interest. So I'll go back to the Lagos example. The difference in Lagos, I tell people, is that the government of Lagos State has put its face on stating categorically that domestic violence is a quasi-criminal issue in Lagos State. So even if you beat your wife in Lagos, chances that you might walk away, the way you do in other parts of the country is not likely. And the police in Lagos are also still part of the National Police Service, but they know that there are certain things that are not acceptable in that state.
Right.
So they comply to the ethos and the ethics of that state, right? So if you find the political face and the government of the Federal Republic of Nigeria saying no, zero tolerance to sexual gender-based violence, and the body language is straight and it's direct, chances are that the police would align and ensure that there's enforcement.
Yeah, absolutely. Thank you, Kemi. I think we're at almost 10 minutes to the end, so I'd like to open it up for a question.
Would you want me to come in?
Sure.
Okay, so if you ask me, I would say that I am not sure that the little success that we made would have been possible without a sustainable collaboration between the agencies and the civil society or non-governmental organizations. This is because a lot of the gains have been funded by civil society organizations. There are civil society organizations who are willing to provide pro bono services, who are providing psychosocial support service. Civil society organizations who have the shelter and will be able to accommodate survivors and victims in their centers as well. civil society organizations who are collecting information about or doing needs assessment and are looking for funding to provide the needed and requisite knowledge, skills, and training for our agencies to be able to work and understand the issues better. And civil society have also been the one doing a lot of advocacy work around what the gaps are. And this is when we engage with the agencies, they are able to share what the challenges they have are, what the gaps are, and we, on their behalf, also engage with policymakers by undertaking several advocacy efforts, lobbying, campaigns, and other things to ensure that government is able to also do its work, and especially also on resource mobilization. Civil society is also able to do that for the agencies in question. So yes, I think it is partnership and collaboration that we should continue to strengthen and enhance, because if you leave the agencies, government budget is already creating a big vacuum. They don't have enough. And an example is also that when USAID cut funding, the government of Ghana this year had to announce that they have to look for money from everywhere or anywhere that they can find to be able to fill the vacuum. So it only told us that some of the services or what we were getting from the USAID for the government of Ghana intervention, which are very critical, some resources needed to be redirected in that area. And so what do? So it means civil society will continue to be a key and critical partner in this. We've had civil society organizations who have availed themselves for the agencies to call them to be the ones who are providing the funding for survivors to go to undergo the test at the hospital so that they could continue with the cases. And it's also, we've also have some of them providing certain support services, like I said, psychosocial support services, because they have in-house therapists and psychologists who are providing this for free without charging anything. And even in terms of schooling, skills development, and other things. So yes, we are doing so much, but a lot more needs to be done. And we only hope and pray that civil societies will not get to a point where there is no funding available or accessible, so that they can also continue to provide the supports that we currently enjoy from them. Thank you.
Thanks very much, Bosch. Absolutely well said. I think that, particularly in this moment where we've seen so many cuts, it's devastating for a lot of communities. Yet, I think in a lot of conversations happening here across Africa, other regions, it's really forcing everyone to, as they say, think outside the box and figure out how we can recognize resources that are other than financial, that are essential, and think more about how we look at this holistically and get the understanding and buy-in of all parts of the community. I think we had a question here that it looks like it was answered in terms of the relationship between institutions and civil society. I know we have a gentleman who wants to share the context in Haiti. Let's see if we may have like a minute to do that, if you wanted to introduce yourself, and then we can go to maybe just closing remarks from everyone. And I hope that Rita's back on or able to join us. We'll see. So, Monsieur Pascal, Madame, excuse me. Please, if you'd like to come off the mute and share some perspective on what's happening in Haiti.
Est-ce que vous m'entendez?
Oui.
Vous m'entendez?
Oui, nous entendons, but
D'accord. Bonjour, je suis Pascal Solage. Effectivement, je viens d'Haïti et je travaille en Haïti où je dirige une organisation féministe qui travaille justement sur les questions des violences basées sur le genre et qui, malheureusement, que ce soit dans le contexte d'aujourd'hui ou bien depuis notre existence, a dû en priorité s'occuper de la prise en charge et de l'accompagnement de femmes survivantes de violences. Et je retrouve beaucoup de similarités avec les différents contextes qui ont été présentés ici, mais je pense que ce qui a beaucoup attiré mon attention, c'est aussi les informations qui ont été partagées sur la question de la police, parce que nous avons connu et nous continuons de connaître aussi ce genre de défis. Les organisations de la société civile haïtienne font littéralement le travail de renforcer, de sensibiliser, de former des institutions comme la police nationale pour qu'elle puisse justement jouer son rôle de relais dans la question de la prise en charge des femmes et filles survivantes de violences. Mais malheureusement, l'autre part qui doit être prise en charge par des institutions étatiques, malheureusement, n'est pas présente. Et c'est pourquoi on a eu pendant des années des sections genre qui ont été installées, développées au sein des commissariats en Haïti. Et dès que le financement qui était apporté par une ambassade étrangère a pris fin, ces sections genre ont disparu. Mais au-delà du fait que ces sections genre existaient, des féministes haïtiennes ont été obligées aussi de dénoncer, de publier des articles ou bien de participer à des émissions pour dénoncer aussi ce qui se passait lorsque des femmes et des filles survivantes de violences allaient porter plainte au sein des commissariats ou bien chercher de l'aide. Parfois, nous étions obligés de les accompagner parce que nous savions justement qu'elles avaient besoin de quelqu'un soit pour les défendre ou bien pour les supporter parce que c'était aussi des espaces d'extrême violence où ces femmes et ces filles aussi confrontaient de la discrimination de la part de ces institutions qui devaient les accompagner. Et le fait que des institutions comme la police nationale soit dépendante de financements étrangers pour pouvoir avoir des sections qui adressent la question des VBG est extrêmement problématique parce qu'à des moments, ces sections n'existent pas dans un contexte où les violences, notamment avec la question des gangs en Haïti, est extrêmement élevée. Et parfois, c'est aussi extrêmement performatif. Ça veut dire qu'on retrouve beaucoup d'activités, d'événements où on invite des institutions comme la police ou d'autres institutions étatiques pour parler sur la question des violences basées sur le genre, mais au niveau politique, au niveau de décision, au niveau de financement, au niveau d'action, il n'y a rien qui est fait pour que les institutions puissent réellement accompagner ou bien faire leur travail, que ce soit au niveau judiciaire ou policier ou sur la question des plaintes, pour les questions de violences faites aux femmes et aux filles. Et souvent, les organisations de la société civile, notamment les organisations féministes que nous sommes obligées d'utiliser des leviers pour pouvoir faire pression et que ces institutions fassent leur travail parce que nous ne pouvons pas remplacer la police, nous ne pouvons pas remplacer la justice. Donc aussi, quand nous sommes dans des contextes de conflit comme celui que connaît Haïti et que je sais qu'il y a beaucoup d'autres pays en Afrique qui le connaissent aussi, avec parfois des institutions comme la police du Kenya qui arrivent ou bien d'autres institutions comme des missions onusiennes, ce sont des défis encore majeurs que la société civile doit confronter parce que ça crée d'autres acteurs dans l'écosystème avec lesquels nous devons soit collaborer, soit dénoncer, soit monitorer. Et ça amplifie le travail que nous devons faire alors que les ressources et parfois même l'expertise n'est pas présente. Donc, j'ai été beaucoup interpellée un petit peu par cet aspect des interventions que vous avez fait. Et j'ai beaucoup appris et je pense que ça va aussi nous servir en tant que personnes intervenant sur le terrain en Haïti parce que non seulement les similarités, mais aussi ce que vous arrivez à dégager en termes d'action sont extrêmement importants en termes de partage parce que je pense qu'on se nourrit aussi de cela. Donc, merci beaucoup.
Merci, Madame Pascal. Thank you very much. And really all our best wishes and wishes for strength and fortitude in the context in which you're working, because, you know, we didn't talk as much about situations of GBV, violence against women, in kind of active conflict context. And so, yeah, we wish you continued resilience in addressing those issues. And perhaps, I don't know if Kemi or Bosch, you want to respond to anything in terms of in the context where, of course, in Nigeria, there's parts of the country that are experiencing violence more frequently than others. So I don't know if you wanted to respond to that.
I think it won't be right to say that there's certain parts of the country that are experiencing violence more than others in Nigeria. It's the face of it that differs. There's no part of the country that you would say that there's no element of a typology of violence that you're seeing. However, and this will be my closing comment, I would say that, you can't build something on top of nothing, right? So when there are issues, you see the challenge with the system. That's what we see in country. When we have not put in place the appropriate frameworks and frameworks beyond policy, beyond legal framework, also the element of accountability and responsibility on those and on the duty bearers and even on the part of citizens, right? When there comes a bit of tension, everything will be magnified. And that's what I believe we see. When we say survivor-centered policing, yes, police and law enforcement, yes. Beyond police and law enforcement, it's talking to transformation, it's talking to building trust between the citizens and the government, right? And the agencies of government, and the police is one. Police is the face that we see regularly. But how does the responsiveness and the effectiveness of the Ministry of Justice, of the Sexual Assault Referral Center, of the courts, how do they also interplay in all of this? But it's easier for us to hold the police because they are more visible. The inefficiencies of the SAC, of the medical, of the prosecution from the Ministry of Justice, the time frame it takes for the courts to go through the process. There's no way you get a survivor to keep coming to court over a matter for 2 years because the person wants to move forward. So we need to look at it as a whole, right? As we're engaging the law enforcement, we also should be engaging the other actors within the system. That is when trust can be built. That is when it will not be easy to sell the narrative to the survivor that settle out of court, because to go to court means that it's going to take you forever. To go to court means that we're going to amplify what the challenges are. There's no support, social support. So where are you going after this? So the shelters are not there. The social infrastructure that provides protection for the citizen that is in need is not there. Thank you.
Thank you so much, Kemi. Yeah, I think our theme is, everything all at once. It's what we need to keep moving forward with. Bosch, may I ask for a few closing thoughts on your side?
Well, on my side, I would commend Partners Global for this work. It is not just a necessary work to be done, but work like this become a tool that helps us to advance the work that we do and justify why it is important for us to continue talking about this and taking action and all of that. Whilst doing this, it's also important for us to recognize the fact that the issues about women have no borders. That wherever women are, they need protection. And there shouldn't be any buts or ifs. What is important is that they are protected. So convenings like this are important for us to share what is happening in countries and how best we can continuously provide support to women and other vulnerable groups, and especially also because we all belong to international laws and then conventions and other protocols for the adoption of countries. So it is really critical for convenience like this to continue to happen. Thank you very much.
Thank you, Bosch. Absolutely. I think that was really our purpose twofold, not only to kind of see where we are, what has happened since the report was published, but to, as you say, continue the conversation and hopefully make new connections. I think that, encourage anyone who has attended to reach out to us, to the panelists, and try to share your experience, and we can learn from each other. And as we've seen, and I think it's true then beyond the West African region, that so many of these issues are universal. And then also is the need universal for us to approach things in a holistic manner. So I want to thank everyone for joining. I apologize that we've gone a little bit over, I think because of our late start. Again, if you are interested in reading the report, please go to our website. We encourage you to, remain in touch with our organization. We'll continue to have these conversations going forward as we are really focused on how to push forward some of the recommendations made 3 years ago and then kind of updated today. I also want to thank the Partners Global team, Christian, who led us off, and then Jeffsky Plancy and Cecia Hernandez. And then also our wonderful interpreters today, Fadma and Leah. Merci beaucoup. We appreciate your assistance with everything that you helped with communications. So again, thanks to everyone for joining us. Keep on doing what you're doing and contributing to help make things better for protection of women and anyone who has survived gender-based violence. Take care, have a good rest of the evening, and we'll see you next time.
Thank you.